Herkese merhabalar. Bir video çekmek istedik Dr Reinisch ile beraber. Türk aileleri de bilgilendirmek amacıyla. O yüzden bazı sorularım olacak. Let's start the questions. You ready?
No.
I'm ready, I guess.
Don't be nervous.
Microtia nedir? Nasıl ve neden olur? Tipleri nelerdir?
Well, Microtia means small ear or absent ear. And it can vary from being a almost normal ear, which we call grade 1, or to nothing, which we call grade 4. The most common type that we see is grade 3, which is earlobe, but not much. And Microtia almost always occurs with no ear canal or a very narrow ear canal, which doesn't work very well. So when we ask families who have patient with Microtia, is there anyone else in your family with Microtia? Almost 95% say, no, we don't know where it occurred. But some say, yes, I had an uncle with Microtia, or I had, my father had Microtia. Not so much, but so we think that there is some genetic tendency, and in certain parts of the world, it is more common than other parts of the world. So in the United States, we see more Microtia on the West Coast than on the East Coast. It's also true in South America, there is more Microtia on the west side of South America than on the east side. We think that maybe genetically that we are more related to Asia on the west coast of North and South America because there may have been a migration of Asian people either across the land bridge and down the coasts or by ship many hundreds of years ago.
Çocuğum tek taraf Microtia. Nereden başlamalıyım?
So when the baby is just born, we want to get a hearing test in the good ear to make sure that it is hearing well. Because about 1 in 20 or 25 children with Microtia have some hearing loss in the other normal looking ear. If they have some hearing loss, then it is very important to get a hearing device, a bone conduction hearing aid, early. If they have good hearing, they will learn to speak very well. And when they are 2 years of age, we can get a CAT scan to see if the middle ear is good enough to make an ear canal.
Yapılan kulak, his ve olgunlaşma açısından nasıl olacak?
So when we make an ear, in the beginning they don't have much feeling. But as it heals, they will have feeling, but not very fine feeling. So, for example, a mosquito, if it lands on their ear, they won't feel it. But if you touch it, they can feel it. And you asked about growth. So ears grow, when children are born, they have a bigger head, and their ears are almost adult size by the time they are 4 years old. Now, some people, when they get to be very old, the ear gets long, mainly because the earlobe hangs. But we can make an ear when a child is 3 years old. We make it a little bit bigger, but when they are finished growing, it's not like the ear that we made is small and the other one gets so much bigger. They will match.
Kulak kanalı açmak riskli deniyor. Kanalın kapanacağı söyleniyor. Sizin yorumunuz nedir?
So we hear that frequently, and it's by doctors who have little experience with this surgery. But we have done so many ear canals, we have learned how to keep the canal from closing, and we don't see, after doing over 1,000 of these canals, we have never seen any injury to the facial nerve that makes the face move. So during the surgery, there is a monitor that can tell us if we are close to the nerve and would make an alarm. I think it's because the doctors that many people have gone to have never seen a successful ear canal. So we don't worry about closing, and we don't worry about the nerve injury because we don't see it. We are very careful to avoid those problems.
Kullanılan malzeme nedir?
We use polyethylene. It's a type of plastic material that has been used in other areas of the body since the 1950s. And it is very well tolerated in the body. It is not rejected. It's used in the eye, it's used in the knee, it's used in the hip. And for cosmetic, it's used for the chin, the cheeks, the nose.
Ameliyat sırasında ve sonrasında ağrı ve kanama olacak mı?
So during the surgery, we use a special instrument that keeps it from bleeding. So we have really no bleeding during the surgery. And after the surgery, we make everything numb. Like a dentist, we inject anesthesia locally. Local anesthesia. So when they wake up, there is no pain. And after that wears off, by the next day, there's very little pain. So most children take very little. Some children take no pain medicine. And the fact that we have little pain allows us to do the surgery without being in the hospital.
Ameliyat sonrası yapılması yasak şeyler nelerdir?
So after the surgery, we don't want the child to sleep on their new ear for the first 2 weeks. Then you can start to sleep on it for a brief time, but after about 4 weeks you can sleep on your ear. We like to wear the mold for the first 4 months to protect the ear at night only.
Geceleri sadece.
And after 4 months we don't need anything and they can sleep on the ear without the mold. In the first 2 weeks it's also important not to have water under the mold because it will not dry. We take the mold off at 2 weeks and then you can wash it and get it wet. If you have a new ear canal, then we like to put some Vaseline on the dressing to keep water from going in the canal when you are washing your ear.
Ameliyat başarı yüzdesi nedir?
The success is very good. That's the reason we have been doing it for 31 years and we have gotten better over time. But I would say the percentage is 99% because all children after surgery end up with an ear, but some children, maybe a few percentage, may have to have a touch-up or a secondary surgery to correct something, but usually 95% of children who have ears only need one surgery. Yeah, we have done about 2,000 ears now, and I can think of maybe 5 or 10 that had a problem where we could not make an ear and it was not successful. Usually those patients have had surgery before and it made it more difficult.
Yüz asimetrisini düzeltiyor musunuz?
Yes, during the surgery to fix the ear, we also try to improve the facial symmetry either by fixing the nerve issue, which some children have, or adding some fat to the cheek, which is usually smaller on the side of the smaller ear.
Sendromu olan çocuklarda kulak yapıldıktan sonra düşme riski var mı?
Yeah, there is no greater risk of the ear coming down if your child has a syndrome than in any other child. We do see the ears come down a few millimeters normally, and sometimes we will make them a little bit higher by 1 or 2 millimeters, knowing that it will come down. But we don't find that it descends more in syndrome children. I should say that most children who have syndromes have bilateral microtia.
Kaç senedir Medfor kullanıyorsunuz?
I developed the method and was the first to do ear reconstruction with that material, and we started in 1990. We did some adults then, and in 1991 we started doing children, so it's been 32 years.
Ne kadar sürede kulak iyileşiyor?
Well, the ear starts healing right after the surgery, and the color and the shape continue to improve for about 4 to 6 months after the surgery.
Totalde Amerika'da ne kadar süre kalınması gerekiyor? Kontroller ile toplam süre ne kadar?
So our patients usually come 1 or 2 days before the surgery.
Like us.
Yeah. And they stay 4 weeks after surgery if they do the ear and the canal together. If they do the ear and not the canal, they can stay for just 3 weeks.
Herhangi bir darbede kulak kırılır mı?
So, no.
No.
The implant is very strong. When we first started doing it, after a few years, we saw more fractures. And so we have changed how we construct the ear implant. And now we don't see many at all. And since we are doing mostly boys, and they're mostly 3, 4, 5-year-old, I'm surprised that we don't see more fractures. If there is a fracture, it isn't urgent to fix it. It can be fixed a year later or 2 years later. It's not like a teacup where the ear just crumbles because the tissue grows into the implant and keeps its shape, but the shape changes a little bit.
Okay.
And many times when we see patients, we are the ones who say, I think your implant is broken. And the parents had no idea.
Aa.
But it is much less common now than it used to be.
Ameliyat ve kontrollerden sonra tekrar Amerika'ya gelmek gerekiyor mu kontrol için?
No, it is not necessary to come back after surgery. We like parents to send us pictures in the beginning every month or two, and then every year. And we travel a lot. We go to Europe, we go to Russia, we go to Mexico, to China, to Korea, to South America. And in those visits, we like to see our old patients.
I hope you will come to Turkey too.
I do too. Yeah.
Türkiye konferansa bekleniyorsunuz. Doktor Robertson'la birlikte gelir misiniz?
Yeah, so we have been working together for about 16 years, Dr. Robertson and I, and for the past I don't know how many years, since that time we have given conferences together, and so usually we travel together and see patients together. Occasionally I will go and bring a video of Dr. Robertson talking, and then he can Skype individual patients if their scan looks like they can have a reconstruction.
Okay.
And we are hoping to come within the next year.
Önümüzdeki sene içerisinde gelmeyi planlıyorlar. Geliyor olacaklar. İnşallah. Türk ailelere söylemek istediğiniz bir şey var mı?
Well, we understand that it is difficult for a family to come halfway around the world to a country where they don't speak the language and don't even recognize our alphabet. So we want to have families from Turkey come, and we want them to have a good experience. We want them to think that it was the best decision they ever made for them and the children, and we want them to enjoy the time they're here. So we are anxious to help them with translation, with getting a visa, and finding a place to stay. And the more patients who come from Turkey, the more help we can give them, because we have many patients, for example, from Russia or from China. And so in our office, we have people from Russia and people from China who work here. And if there are many patients from Turkey, we will end up hiring somebody who is Turkish, to help them. But I think Los Angeles is a very big city with many different languages, and it's very easy to find someone to help.